Welcome back to the Doctor Is In television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon right here on the beautiful Central Coast of California. Thank you very much for joining us. In the next 19 minutes or so, I'd like to talk about body contouring. I have a very special, distinguished guest, a licensed esthetician, Gio Stefagio. Gio, thank you very much for coming on the program.
My pleasure. Thank you for asking me.
What we're going to talk about today is body contouring, and I'm going to give a summary of the three general groups, general categories of how we approach body contouring in plastic surgery. The first is the open approach, things like tummy tucks, thigh lifts, etc. The second is the closed approach. That's essentially liposuction or micro liposculpture. The third category is the use of external devices, such as cool sculpting or heat or radio frequency, infrared devices, etc. And then we're going to have Gio talk about her own experience with body contouring. Gio had a combined approach, a tummy tuck, also called an abdominoplasty, also combined with some liposuction at the same time. So she had a combination of the open approach and closed approach. Gio, thanks very much for coming on the program.
Thank you.
So why don't I give a brief introduction to the three general categories of body contouring. Then I'd like to ask you about your experience, how long you had thought about body contouring, what was it that made you think about some body contouring, both the open approach and the closed approach. And we'll talk about your experience.
Okay.
And I really appreciate you being on the program. So, as I said, there are three general categories of body contouring. The first category is the so-called open approach. That's where we make incisions. Generally, the incisions are long, and hence it leaves long, permanent, visible scars. But we are able to remove big blocks of skin and fat at the same one stage. We can just really remove folds of skin and what we call the pannus, when skin and fat hangs down off the abdomen. So we can make a long incision and remove a big block of skin and fat. If necessary, we can tighten up the muscles on the inside. Oftentimes after pregnancy, weight loss, etc., the fascia, that's the connective collagen tissue covering muscles, oftentimes that gets stretched out. And so even if you do 1,000 sit-ups, the muscles can get stronger and tighter, but the overlying fascia is stretched out and it won't go back to its original resilience or original size. So the open approach is a bigger operation. Oftentimes it requires drains. It requires typically a general anesthetic. It's very powerful though. We can remove big blocks of skin and fat, and we can tighten up the muscles if we need be. The downside is it's a bigger operation. Sometimes drains are needed. It's a longer recovery period. And there's a long, permanent, visible scar. Now, what about the closed approach, so-called closed approach, which essentially is liposuction? That's when we make a very small incision, very tiny, almost like a mole removal. We can put in a cannula, it's a tube, and we can vacuum out fat. Now, it really works. We can remove a lot of fat cells, and the scars are very small, quite inconspicuous. And oftentimes we can negotiate the position and the location of the scars. The downside is we cannot remove skin with liposuction. Now certainly there's a little bit of skin resilience, a little part of skin shrinking with the procedures, microliposculpture, liposuction, etc. But we can't remove a lot of skin. Certainly we can't remove any skin with liposuction. There is some shrinkage, but it's not profound. Now just to be complete, I want to talk about the external devices. Cool sculpting, for example, there's no incisions, it's done in the office, there's no downtime. There's a applicator, we call it a platform, but it's an applicator that sucks in some soft tissue like skin and fat. It stays within between the applicators. It's attached to a computer. The computer lowers the temperature of the soft tissue, the skin and fat, to freezing point, and then it cools off. And over the course of the next 4 months, about 18 to 24% of that subcutaneous fatty layer will be absorbed by the body. And it really works. However, it's only 18 to 24%. I would say that's a minimal to moderate change. It's great for spot reducing, let's say you work out a lot or you have a couple problem areas that just won't respond to exercise, or you just have some baby fat remaining, I think CoolSculpting is good for that, but it's not profound like we can get with a tummy tuck. It's not or profound like we can get with liposuction. The other devices, radio frequency, external heat, infrared, those type of things, if they work at all, they may not work. If they work at all, it's minimal. So again, to recap, there's the open approach to body contouring. We can make incisions, remove big blocks of skin and fat, tighten up the muscles if need be. It's a bigger operation. It leaves scars, long permanent visible scars. Liposuction, it really works. It's effective at vacuuming out a lot of fat cells, but we can't remove skin. And we talked about the external devices being no downtime, no incisions, but really minimal to moderate change. So with that introduction, Gio Stefagio, you have a master's esthetician license. So in other states besides California, that means you can actually do things like laser.
That's correct. And microneedle and things that California estheticians are not allowed to do. It's outside of their scope of practice.
I see. So other states you are allowed to do that. California is somewhat restrictive.
Correct.
So what are some of the things that you like to do as an esthetician before we start to talk about body contouring? What do you like to do as an esthetician?
In California, clinical facials. I am more into correction and anti-aging. I'm also licensed in the state of Washington as a master esthetician, where I can run an IPL under the doctor's supervision, of course. Very similar to what an RN can do here, I can do in other states.
Okay. So when you do medical grade facials, esthetician care here in California, what are some of the things you do? I'd like to, if we can, and we have some time, I'd like to get into the essentials of proper skin care, like avoiding sun, avoiding smoking, learning how to properly cleanse your face, exfoliation, stimulating and regeneration. I'd like to get into those if we could. Let's teach our audience.
Sure.
So what's a facial like? If I go to see an esthetician, what's a facial all about?
Well, first I would cleanse your skin. I'm going to talk about my own protocols. First I would cleanse your skin twice, and then I would get a magnifying lamp and then look at your skin very carefully and determine at that point whether your skin was dry or you needed extra hydration, whether you had hyperpigmentation, rosacea, because that would determine the type of products that I would use on your face.
Okay, let's back up for a minute. Gio, this is very helpful. Now, how does an esthetician cleanse the skin? What is it that you do to, I don't think that you just take bar soap and wash the face, do you?
No, we do use very special products. I also use a Clarisonic brush, which I find much more effective than using just sponge, or some estheticians just use their fingers, use their hands to cleanse. That's more of a European approach. The more clinical approach is actually using sponge, but like I said, I use a Clarisonic brush, which I think is much more effective in massaging the pores open and getting out the extra sebum and dirt that may be on the skin that you can't get out with just a normal washing.
Okay, so you do a cleansing and cleaning process, and then you were about to say you do an inspection process.
Correct. And depending on the type of skin that you have, you might get a steam. Some people don't get a steam. If you've got rosacea, for instance, you're not going to get a steam. But if you don't have rosacea, you can get a steam and then a mask. And then the mask comes off, and then you get a treatment. You might get another mask. It just depends on the type of skin that you have and what we're trying to do.
Well, Gio, this is actually great for me to hear. And I wonder, if you have time today, we're going to keep you in the studio, and we're going to ask you to do another segment on skincare.
Okay.
And go through what you do, because I would like to teach the audience about body contouring and talk about your experience with body contouring, if that's okay.
Sure.
So what is it that caused you to think about having some body contouring procedures?
Primarily my age. I used to be very, very fit, very thin, and then I gained weight. As you get older, you gain weight. Your body doesn't go back to the shape that it was before. The weight kind of redistributes itself in a different way, primarily between the waist and the knees. And that's where I had my weight problem. And
Gio, let me interject. So when I talk about the triangle of facial rejuvenation, there's 3 parts to the triangle, and many people in the audience probably have heard this. There's 3 parts to the triangle. Number one is skin, and we're going to talk about that. Number two is volume, and number three is soft tissue position and amount. And when we talk about volume, I teach my patients, as we mature, we tend to lose fat in the face and in the hands, and we put weight on in the trunk. And that's just a kind of an unfunny practical joke, isn't it?
It
And
is.
It comes with age and hormone changes and activity and metabolic demands, etc. So, as you were saying,
So as an esthetician, I'm also CoolSculpting certified. And I knew that my type of fat and the results that I wanted to get, I was not going to get with CoolSculpting. Even though I had experimented a couple of times on both sides on my flanks,
okay,
I knew that what I wanted to correct could only be corrected with a tummy tuck and liposuction.
okay. So you had a combined approach. What I was talking
Yes.
about a few minutes ago was that the open approach is a tummy tuck. We can remove big blocks of skin and fat. If need be, tighten up the muscles on the inside. The closed approach, so-called closed approach, is liposuction, where I vacuum out fat cells with a cannula. It's a tube. And you had a combined approach. So tell us about that. Tell us about the decision-making process. And is it okay if we tell people on this program that I am your plastic surgeon? Is that okay?
Absolutely.
Okay.
Yes, absolutely. As a matter of fact, I think they ought to go to your office and see my before and after pictures.
Well, Gio, you're very gracious, and thank you for saying that. You've been a terrific supporter, and I admire your work. So, you had choices. You could have, again, gone to the external devices. You could have had just a tummy tuck. You could have had just liposuction. But you elected to have a combined approach with the tummy tuck and liposuction. Isn't that right?
That is correct. And I figured I was probably going to have that. But after consulting with you, the decision was made that for the best possible result, not just a tummy tuck, but the liposuction as well would be best for me. And it was.
Okay. So, in terms of the specifics of the operation, I think a big reason you elected to have the tummy tuck because we thought you had some extra skin, right?
Yes.
So to make a large incision, an elliptical incision, that allowed us to remove a big block of skin and fat, right?
Yes.
Okay. Now the liposuction part, we went through the corners with a tube, it's called a cannula, and we vacuumed out more fat beyond the area where the excision was, where the incision was. Isn't that correct?
That is correct. And you did it along the sides, giving me a very, very contoured waistline, which I'm very happy with, like hourglass.
Women dig, I should say, that's a jazz term. Women dig the hourglass figure, right?
Oh, it's beautiful. I love my results.
Great. So tell us about more of the specifics about the mechanics of the operation. I don't think this was done in the office.
No.
You elected to have an anesthetic
Correct.
on an outpatient basis, right? You got a whiff of anesthesia. I think it was at the surgery center?
We did this one at CHOMP.
Okay. So let's clarify. So at the hospital, that's CHOMP, Community Hospital of Monterey Peninsula, there's a main operating room, which is part of the hospital. And then there's an outpatient surgery area that's like a surgery center, day surgery, in and out surgery, sometimes people call it. And it's connected to the hospital with a hallway. But it's not the main operating room. It's not in the hospital. So a lot of people are much more comfortable going to the outpatient surgery center. Isn't that correct? Do you find that?
I think so. It's very discreet. It's on the other side of the hospital, so you're not having to walk through, the waiting room or anything.
Okay. So you had a combined approach of the tummy tuck and the liposuction. So the mechanics of it, you didn't stay overnight.
No.
So tell us about coming into the hospital and getting prepared and what that was like.
I got there early in the morning. I did not have anything to eat or drink as they directed. And everything was very comfortable as I was prepped for the surgery. They give me these little wet towels that I wiped my body off with to make sure I didn't have any germs.